क्या हम 11 अप्रैल से 14 अप्रैल पूरे अपने राज्य में टीका उत्सव मना सकते हैं? हम ज्यादा से ज्यादा एलिजिबल लोगों को वैक्सीनेट करें।
However, the number of people who got vaccinated in those 4 days of the so-called vaccine festival was less than the other days of April, raising questions over the effectiveness of the Tika Utsav and trust in vaccines. Several states denied third vaccination phase, and also there is high shortage of vaccines even now, which raises lot of questions over government's saying and doing. People's mind was clouded with questions such as, should we even take vaccine? Which vaccine is good? Is there any best vaccine? Covaxin or Covishield? Should we wait for the so-called best vaccine? And now that several Indian states have stopped their vaccination drive due to shortage, there is more to people's doubts. Whether we can skip the second dose. What will happen if we skip the second dose? What if we mix two different vaccines? In this video, we will quickly understand the importance of vaccine against COVID, which vaccine is the best, whether you should even take vaccine or not. Can you mix two different vaccine doses, etc. But before proceeding, please subscribe to our channel if you haven't already and hit the bell icon for regular updates. So what exactly a vaccine is? A vaccine is a biological preparation made using a weakened or dead form of virus. It is introduced into your body, hence leading to the production of antibodies in order to learn to protect itself against the virus. Should you even get vaccinated? Without a doubt, yes. Government-approved vaccines are safe and everyone should be vaccinated in order to get more immune against the virus. Ever since the Covid-19 vaccination rolled out this year, one question that has been bothering many Indians is Covaxin or Covishield. Covaxin is produced by Bharat Biotech using inactive form of the virus, and Covishield is made by the Serum Institute of India using genetically engineered adenovirus that infects chimpanzees normally. It's too soon yet to claim the effectiveness of the two using a promising set of data, but manufacturers claim the efficacy to be near 70% and 80% for Covishield and Covaxin respectively. Which is the best vaccine, and should we wait for vaccines such as Sputnik V and Pfizer's vaccine as they seem to be more promising? While there are many mild cases of COVID-19, about a fifth of infections result in severe diseases and nearly 1% of infected people die. 1% might sound very less to you, but when accounted, the number of deaths in India has already crossed over 3 lakhs. Having said that, the answer is simple. Any vaccine which is available to you right now is the best vaccine. At the time when second wave has claimed so many lives in India, there is so much shortage already, being immune and vaccinated should be the priority. You should not wait for the availability of vaccine of your choice. Sputnik V claims to be 90% efficient, which is more than its alternatives present right now, but it's still unsure when will it be available for masses. Hence no, you should not wait and put yourself at risk just for the sake of any so-called manufacturer-claimed best vaccine. All the government-approved vaccines are capable enough to help us develop antibodies for coronavirus. It is of utmost importance for us to understand that we have limited capacity to produce vaccines, and hence there can be different vaccines available based on the production. Are there any side effects? When we get any vaccine injected, the vaccinated area may pain a little or get swollen. Some other side effects might include fever and fatigue. Why there are 2 doses of COVID vaccines? Sometimes immune response to the first dose called the priming dose is rather weak. Hence, second dose or booster dose is required for a strong immune response that can counter the virus or the disease more effectively. When people are being tested positive even after getting their vaccine shots, is it even worth? There is no reason to get chaotic and start doubting the vaccines at all. Such a situation is called breakthrough, and cases of breakthrough infections are very low, plus vaccinated people have shown less severe COVID-19 symptoms. Right now, the question that is spreading like wildfire due to shortage of vaccines is whether we can mix 2 different vaccines available to us right now, that is Covaxin and Covishield. Some experts strongly believe that unalike vaccines should not be mixed as they were made differently and our body's immune response to non-identical vaccines can be different. Although theoretically, vaccines can be mixed, and some studies also say that immunity can even be more promising in such cases, as in the past, the strategy of combining vaccines was adopted during the Ebola outbreak. For now, since there are no studies or just ongoing trials on whether Covaxin or Covishield doses can be mixed, it's better to stick to one. But what if we miss second dose due to this? Well, to get stronger immunity developed, one should not skip or miss their second dose, but due to shortage of vaccines and lack of appointments, if you are not able to get your second jab within the recommended gap, please don't panic and think that your first shot would go waste or useless, and try to schedule your second shot as soon as you can. Please remember that getting a jab against COVID-19 makes you somewhat immune. It doesn't really make you unshakable, so kindly don't be careless and do practice all the preventive measures to make sure everyone else around you stays safe. Thank you for watching till the end. Please subscribe to our channel and hit the bell icon.